Hi, I'm Nadine Bean. I am, most importantly, mother of three daughters who are now 28, 23, and 20. My middle daughter, now 23, about 5.5 years ago, was in a catastrophic auto accident, a single car accident. She was alone. And she broke 7 vertebrae, C5 and C6, T7, 8, 9, and 10. And for those of you who aren't familiar with the naming of the vertebra, if you think about actor Christopher Reeve, he broke 1 vertebra, and that was C5. And so my daughter broke 6 more than that. She also had 5 strokes, and she wasn't found for 2 days because she was alone and was down a ravine. When she was finally found, she was life-flighted to a major trauma hospital in Philadelphia. And we embarked on a path to recovery and rehabilitation for her, but also we embarked on a path full of nightmares in fighting with our medical insurance company over every single bill. At one point, my medical insurance company challenged her, having been life-flighted to this major trauma hospital in Philadelphia, because they said it was not a network. I didn't even know there was such a thing as in-network or out-of-network for major traumas and the hospitals that take care of these victims. This is all to tell you a little bit about why I am so passionately behind comprehensive health care reform in Pennsylvania, really for the nation, but we're starting in Pennsylvania, and I think we have a more than a fighting chance right now. I think the timing is right. Everyone, almost, say 98% of folks, even those who are comfortably middle class and who think that they are adequately insured, and that was my story when my daughter was in this auto accident, everyone is really one catastrophic accident or major illness away from struggling to make ends meet. I thought about several times over the last 5.5 years about filing for medical bankruptcy. At one point, the unpaid and challenged bills totaled over $500,000. So today I'm working with this wonderful network of folks from across Pennsylvania, health education and the legislative process in Pennsylvania, to rally for passage of a comprehensive health care reform bill, a single-payer bill, guaranteeing quality health care to all Pennsylvanians, regardless of their ability to pay, by the end of 2007. We are mothers and fathers. We are healthcare consumers. We are, like myself, a social worker and a professor of social work who worked for many years doing public child welfare and early intervention work, and went into homes of families that were struggling with children that had major developmental delays or disabilities, and who struggled with those medical bills. I've met many grandparents over the years who are raising their grandchildren, and many times had to make a choice between getting their own prescription filled and getting their grandchild they were raising school clothes or school supplies or well child care or immunizations. And this simply shouldn't be in 2006 in the wealthiest country on the face of the earth. I hope that other people will join us. We've got physicians, we've got lawyers, we've got healthcare consumers, we've got union folk, we've got business owners, we've got legislators on our side. It will happen, and Pennsylvania will be leading the way in the nation and is poised to make history with this very comprehensive health care reform legislation.